Hello, today we'll discuss about medical surgical nursing, first year PBB.Sc, third B.Sc nursing, GNM. Unit for first year PBB.Sc 14th unit, third year B.Sc nursing, unit 2. Topic is refractive errors. Refractive errors. Here you can see the picture: normal eye, myopia, astigmatism, hypermetropia, right? Normal eye, in that you can see the light rays focus on the retina. In myopia case, light rays focus in front of the retina. You can see here the retina, in front of the retina itself you can see the light rays. But in normal eye you can see exactly here, you can see now the white color short one, you can see the touch in the retina. Okay, but in myopia, in front of the retina itself you can see the light rays is focusing. In case of astigmatism, the light rays focus more than one point. See here, actually only one point you can see in the normal vision myopia case, in hypermetropia cases. But in astigmatism you can see the light rays focus itself more than one point you can see. So because of the unequal refraction of the light in different meridian we can be seen here. In hypermetropia you can see here the light rays focus behind the retina. You can see here sharp, the light ray is focusing behind the retina of the eye. If you see this introduction, a refractive error occurs when the shape of the eye prevents light from focusing directly on the retina. In refractive errors, vision is impaired because a shortened or elongated eyeballs prevents light rays from focusing sharply on the retina. Because of the shortened or elongated eyeballs, you can see this, it will prevent the light rays focusing sharply on the retina. There are four types of refractive errors: hyperopia, myopia, astigmatism. Usually this presbyopia is related to aging, but this is also one of the refractive error you can see. Here how this normal vision, you can see here the pink color rays is there, no? You can see here in the a normal vision lens, you can see cornea, retina, right? See here you can see the point here, the straight line is there, no? You can see that is the retina touching. In the normal vision you can see the light rays, you can see touches the retina. In myopia case you can see here behind the retina itself you can see the light rays, that is uncorrected, that is myopia case, that is nearsightedness. After correction you can see here exactly in the retina itself the light rays is focusing. Here it is corrected with the concave lens, so you can see this light rays directly will touch us to the retina. In foresighted vision, that is hyperopia, you can see here that is retina, behind the retina you can see the light rays is focusing. So after correction you can see here corrected with convex lenses. After doing this correction you can see exactly the light rays is focusing in the on the retina. Hyperopia. What is hyperopia? It is also known as farsightedness. It is a refractive error that causes nearby objects to appear blurrily while distant ones are clear. See here, in this case what the person can see means far objects can be seen very clearly when compared to the near objects. Near objects, if you want to read means they can't able. Why? Because blurred vision will be there here, so they can't able to read properly. But distant objects can be seen very clearly. What are the main causes and risk factors for this? Is congenital. By birth itself it can be seen. Family history. Next, old age, as the age increases, you can see this problem. What are the symptoms? Headache, eye strain and eye pain, squint, fatigue, burning and dryness. How you can assess and diagnose means through history collection. You can take the history. In that you can identify whether it is a congenital or it may be a family history or related to the age. Then physical examination. You can, the person whether can see properly, whether the squint eye is there, whether the person complies that they will have the burning sensation, dryness, everything. And also you also can see the squint eye by doing physical examination. Next, diagnostic through visual acuity test, then retinoscopy. Treatment. The correction is obtained by prescribing correct convex spherical lens determined by the retinoscopy. After doing this convex lens, you can correct this surgical treatment. Laser assisted in situ keratomylosis, that is LASIK, conductive keratinoplasty, laser thermal keratinoplasty, photorefractive keratinoectomy, small incision lenticle extraction, that is SMILE. We will see about myopia. It is also known as nearsightedness. It is the most common refractive error of the eye, in which parallel rays of light coming from the infinity are focused in front of the retina when accommodation is at rest. Here what is happening? The light rays will be focusing in front of the retina itself. It is usually develops during the childhood and adolescence, and it is usually becomes more stable between the ages of 20 and 40 years. Causes and risk factors are genetics, prolonged close-up activities, screen time like use of computers, small devices such as mobiles, video games, environmental conditions. Signs and symptoms. Seeing black spots floating in front of the eye. The person can feel like headache, eye strain, squint eye. How you can assess and diagnose means history collection, physical examination, eye test. How you can correct this one is treatment is myopia is corrected by prescribing concave spherical glasses. Contact lens is quite effective in high myopia, which eliminates peripheral distortion caused by thick lenses. Surgical treatment: radical keratectomy, LASIK laser, removal of clear crystalline lens, orthokeratology. Astigmatism. It is a common and generally treatable imperfection in the curvature of the eye that causes blurred distance and near vision. What are the causes and risk factors? Congenital, injury or trauma to eye diseases or surgery. Symptoms: impaired vision, headache, eye strain, difficulty with night vision, squinting. Assessment and diagnostic findings: history collection, physical examinations, eye test. Treatment: it is treated by corrective lens such as eyeglasses, contact lenses. Surgical treatment: LASIK, photorefractive keratectomy, small incision lenticle extraction, that is SMILE. Presbyopia. It is not an error of refraction but a condition of age-related physiological anomaly of accommodation leading to failing vision for near. See, actually it is one of the refractive error, but it's not a, like a refractive error. Mostly you can see in the aged peoples. That's why it is called as one of the age related condition. What is happening here means the accommodation, physiological anomaly of accommodation of the eye can't be there. So it leads to the failing vision for the near. What are the causes and risk factors are? Age 40 to 60 years, medical conditions such as diabetes, multiple sclerosis, cardiovascular disease. Certain medications such as antidepressants, antihistamines, diuretics. Signs and symptoms: blurred vision, headache, eye strain. How you can assess and diagnose means history collection. That is, you can collect the history related to the age and any injury to the eye, any medical conditions. Next, physical examination. Next, eye test, eye exam, visual acuity radioscopy. Treatment. It is treated by prescribing convex spherical lens which added to the glasses. Surgical treatment: LASIK, anterior ciliary sclerectomy, conductive keratoplasty. Complications of refractive surgery. After doing this refraction correction, that is surgical correction, you can see the complications such as halo as starburst appearing around light, dry eye, infection, cornea scarring, vision loss. Nursing management of refractive errors. Assess the patient for any previous allergy to medicine, food, etc. Advise to go for regular eye checkup. Teach about the route of administration of medications such as oral, eye. In eye, how to apply eye drops, ointment. Educate about the correction methods such as usage of eyeglasses, contact lenses and surgery. Thank you. Thank you for watching. Please share, like and subscribe.